It's now time for Sports Medicine with Malempati.
Again here, Doc, how was your summer?
Yeah, so it's been good. A lot of speaking engagements, quite a bit of traveling. It's been very enjoyable. Always good to be at meetings, learning the latest research, the newest techniques, and getting together with colleagues. Uh, Always our goal is to find the newest stuff, find what we can do to help athletes get back out on the field and compete safely, obviously. So it's been enjoyable. Certainly learned a lot, and it's kind of why we call it practicing medicine, right? It's a lifelong learning and getting better.
Always pushing forward. I notice, you got that drive about you, Doc, and that's something that I really admire. Looking from afar. But uh, today we're going to be talking about MCL sprains. What can you tell us about MCL sprains, especially knee injuries that are very common in fall sports and with football and soccer especially?
Yeah, like you said, William, football and soccer are getting into full swing here as we get into late summer, early fall. And certainly knee injuries in both sports are quite prevalent. The most commonly injured ligament in the knee is the medial collateral ligament, or the MCL, what we're talking about today. And it's the ligament on the inside of the knee. It's outside the knee joint. It can be commonly injured. The good news is most of these injuries can be treated without surgery. It attaches on the femur and on the tibia, and most of the injuries to the MCL actually occur off the femoral side, off the femur. And certainly there's three grades: grade 1, which is a mild sprain; grade 2, which is more severe; than grade 3, which can be a disruption of the ligament off the bone. But most generally do very well with physical therapy, ice, anti-inflammatories, bracing, and players can actually do very well without any surgery and rehab quickly. Anywhere from 3 weeks to 12 weeks in time frame to return to sport.
What is the difference between MCL and other knee ligaments?
So it has a good ability to heal, and like I said, most injuries occur off the femoral side and actually scar down pretty well. When the injury is off the tibial side, more apt to be somewhat of a grade 3 injury or add to instability of the knee. So the only times we actually fix the medial collateral ligament surgically is sometimes when there's a grade 3 injury, typically off the tibial side, and when there's persistent instability of the knee, or in the setting of a multi-ligament knee injury, such as an ACL MCL or an ACL PCL MCL. Sometimes we do fix the MCL in that instance. But the difference between other ligaments is it does have a good ability to heal, does not cause persistent instability, such as like an ACL tear. And patients can do very well and actually can scar down really well with bracing and anti-inflammatories and rehab and therapy.
Speaking of rehab and therapy, what are the treatment options and timeline to return after such injury?
So there's no certainly actual specific timelines, but if you look at a grade 1 injury, you're looking more at a 2 to 4 week kind of time frame. Then you go to a grade 2, which is a more severe sprain of the ligament, and you're getting into the 6-8 weeks potentially. Then you get grade 3, and you're looking at 8+ weeks for full return to sport. We actually like athletes to have full range of motion and strength before they go back to play, because then they're not putting their knee at risk or other structures in the knee at risk. But certainly physical therapy involves cryotherapy, which is ice, getting the inflammation and the swelling down, range of motion, and then getting that quad strength and the overall strength of the extremity back. Bracing can help that ligament scar down and heal as well. Anti-inflammatories can also help in that respect.
Well, Dr. Malempati, glad that we're picking this back up again. After taking a little bit of break over the summer, as far as doing this segments, it's good to have you back and good to share this wealth of information with the public.
Yeah, it's great to be back, William, especially with sports really getting into full force. And hope you're doing well, and hope all the athletes stay safe out there.
Absolutely. That's Dr. Malempati. He's with the Med Center Health down in Bowling Green, orthopedic surgery. And, of course, they're a UK healthcare sports medicine affiliate down there. And we appreciate all they do, especially with the partnership with them. Dr. Malempati.
Thank you, William.
Thanks, Doc.
It's now time for Sports Medicine with Malempati.